Hi everyone, we have our amazing patient here today who's going to be getting facial feminization. Today we're so blessed to help her, thank you. What we're going to do is we're going to lower her hairline. We're going to take this bone off, make it flat. We're going to lift the eyes up, we're going to cut the eye bones off and make them more open. We're going to do a rhinoplasty and give her a gentler, smoother nose. We're going to go ahead and do a mid-face lift where we'll lift the cheeks up. We're going to do a chin reduction, jaw reduction, and tracheal shape. Sound good? Now tell me, what about your face gives you the most dysphoria?
Personally, just my chin and my jaw.
Okay, those two things stand out the most.
Yeah.
What area, from what I talked about, do you want to be the most subtly changed?
I would say probably the cheeks. Yeah, mostly just the cheeks. I would be a subtle change.
Would you say your nose is in the middle of?
Yes, okay. I would say probably in the middle. Yeah.
Okay, so it's a little bit, but not that much. But you would like a softer, gentler nose.
Yes.
Now, when we do the nose, we can make a ski slope or make it straight or just smaller, or something in the middle.
I guess maybe it is a bit of a higher priority because I do want a slope and I do want it to be a little bit smaller and stuff. So I guess that one is also a bit on the higher priority end of things.
So you would like a little bit of a slope?
Yeah.
Of course, we'll do that for you.
Okay.
It's going to be awesome. So I'm going to lower your hairline.
Oh, really?
Right, we talked about that. The hairline incision obviously will be there.
Okay.
We'll do our best to make it so the follicles go through it. The nose incision will be under the nose.
Okay.
I'll put the tracheal incision up here, although the bump is here so it doesn't show.
Okay.
Sound good?
Right, yeah.
Any question?
No. It's just cool seeing.
All right, thank you.
Right.
We're going to be doing full facial feminization. Our amazing patient wants a more feminine face. She wants a softer face. She wants her hairline dropped, eyebrows raised, more open eyes. She wants lifted cheeks, gentler nose, smaller chin and jaw, and she wants the bump gone. We're doing full FFS. We're going to make an incision, pull the scalp down, change all the bones, lower the hairline, put everything back together. This is going to be an amazing surgery. Let's go do it together. Welcome to the OR, guys. It is time for full facial feminization. Look at her face right there. She's an amazing person. Now, she wants lower forehead, less brow, beautiful eyes, smaller nose, smaller chin. We're going to change the whole face. Let's do it. All right, friends, our first step is we're going to make our incision. Now, when we make the incision, we're going to make what's called a trichophytic incision. All right, so we're going to cut perpendicular to the skin edge here. And then when we go down here, we're going perpendicular. But when we cut the hairline, we're going to go parallel. Want nice, beautiful, sharp edges. We want to lower the hairline. Now we're going to cut the skin off. Excellent. And now we'll start undermining. We'll turn this way. And now we gently find, what we're going to find is the subgaleal plane here. We're going to go below the temporalis fascia. There's different layers of this fascia. We're going to go below the superficial layer of the fascia. Find that layer. Now we'll continue elevating. So now we've elevated, we've removed skin, we've elevated the flap. Now we're going to make our pericranial or subperiosteal dissection straight on the bone. We look for the, here we're going to look for the temporal line, which is right here. Going to cut all the way down. Okay. Then we're going to go all the way here. Now we're going to lift this flap up. We're going to use a dissector, gold handle. Gently lift this whole pericranial flap up. Then we're elevating all the way till we get down to the eye socket. You can start seeing the orbital rim right there. That's a very big frontal sinus. All right, friends, so what we've done right now, we've identified the supraorbital nerve, artery, and vein. It's right there. There's a little bleeding there. It'll stop. Don't worry. So I'm okay. And now we're going to dissect over here. So what I'm doing right now is I'm marking out the sinus. Stab. So that's the frontal sinus right there. We're going to drill that whole thing out and take it out. All right, friends, so what we've done is we've marked the frontal sinus. So see how raised this is? We want to bring this down to this level. So this is what we're doing is called the frontal sinus setback. So we want to take this sinus down, bring it down to this level. So we'll go ahead and do that, okay? And now we're going to gently remove. Tina's gonna give me some taps. Gently gonna remove the sinus. Gently, like that. And this is the anterior table of the frontal sinus. Beautiful, came out in one piece. Now let's look and make sure we don't have any brain exposed. If we do, we can fix it. Don't panic. Everything looks healthy, no brain exposed. Now look at this thick, very thick piece of bone. To set the sinus back, we have to take all these septae off, make them flat, and then we'll work on the contour on the exterior. But we gotta take all these big wedges out, okay? So we'll use our drill, and hopefully we won't cut my fingers. If we do, I got 10, it's okay. It's not okay, but we'll survive. Oh, that's excellent. That's what we want. We want it to sit nicely in, be stable, and we're going to use plates and screws to bring it in. But I like that. This side's a little bit higher. I got to bring that down a little bit. But otherwise, we're almost there. This is how we're going to have the plate sit. It looks fantastic. Nice and flat. You can see that. So now we're going to use our titanium plate to measure how much we're going to take down. Awesome. And this is the toughest part. I use self-tapping screws. I don't have to drill too much in the bone. Now we're going to screw it on the skull. Fantastic, very stable. I'm going to mark the areas that we are reducing. See the temporal ridge? How is that reduced? We're shaping the forehead. All right, friends, we're starting the mid-face lift now. We made our incision. Now we're going to dissect up. What we're going to do is we're going to connect the mouth with the midface. Okay. We connect gently. Yeah, you can come out. There we go. Gently, blunt the section, release the attachments to the midface. Stretch. Okay, good. Now I have to flip the passer. I'll take it. Thank you. Let me gently pass this through. The special instrument I had custom made for this procedure. Stop. Or disengage. Now we're going to test it.
Ready?
Go ahead. Fantastic. Relax. Pull. Yeah, that's what we want. We're going to secure our endotine to the scalp. Emily's going to pull really hard without breaking it. All right, friends, now what we're going to do is we're going to place our implants in to do the brow lift. So this is going to help shorten the hairline, decrease the tension of the hairline. We're going to make a little window here to drill our holes in. So we made our windows. Now we're going to get the drill and make our holes. Now we're going to make a hole in the skull here to place our endotines, or implant to hold the scalp up. This is a handheld drill. The drill's a counter wall to our implant. One goes there. Fantastic. And these prongs here will hold the scalp up. Now what I'm doing, I'm closing the periosteum and then we'll advance the scalp, okay? All right, friends, we're gonna start with our jaw reduction. So we can identify the mandible and we're gonna make a little incision, fire. And now what we can see is the mandible is right there. So we're gonna leave a little cuff of tissue that we can suture. We'll make our incision just in about 1 centimeter. And we're exposing the jaw. Now what we're doing is we're bluntly dissecting the jaw. We're not going to expose the chin. We really got to reduce the chin, okay? So we'll make a small incision here. So we'll dissect down. All right, friends, we've dissected the chin. Now we'll be suctioning and cleaning up the blood and removing the bone. So this is the chin that we're removing. Do you see that, Sam? Right there. So we're going to use a special drill to cut the bone off. Now we're going to take this bone down. All right, friends, we're starting with our rhinoplasty. The first step is we're going to make our transcolumellar incision. And now we're releasing the periosteum. All right, friends, our first step is we're going to do the septoplasty. There's the septum. So right now what we're doing is a septoplasty, or we're releasing the nose. Now we're dissecting the septum on the contralateral or opposite side. All right, friends, now what we're going to do is we're going to divide the domes. Now we'll take our 11 blade. We gently put it in the right position. And we're separating the upper lateral cartilages from the septum. Now again, we're going to separate the upper lats from the septum. All right, friends, now we're gonna take the hump down. So we gently cut. So now what we're doing is we're using an ultrasonic rhinoplasty to take the hump down. All right, guys, we did it. What did we do? Facial feminization. Look at where we started, right? Look at the forehead, look at the brow, look at the nose. Still just finished surgery, so still has to heal. Have a look, guys. Look at the nose, look at the brow, look at the eyebrows, look at the jaw, the chin. It's all different. It looks amazing. This is your before picture. Okay, now go ahead. You want to show? This is our before picture. We're going to show her the after today.
Wow. Oh my gosh. I mean, it's just so different. And like nothing was the best way though.
Yeah, now we lost our nasal cast because she was throwing up and it popped off when she threw up. That's purely anesthesia, not me. But we're doing amazing.
The chin, I'm just so shocked by the chin. And can I touch the tree?
Yes, of course. Yeah, it's flat now.
Wow. Oh, wow.
You can't even see the scar. It's hidden so high.
Oh, wow.
Oh yeah, I didn't even notice that.
Awesome.
I
am so excited. Thank you.
That's crazy. I feel like it's so rare that it's like a noticeable difference in the trachea. That's that's visible, like from distance, yeah.
Yeah, thank you. So what you see is different is obviously this is flat, it's just swollen.
Yep.
This is lower.
Okay.
These are more open, these are higher, the eyeballs are wider. The nose has a gentle slope now with a nice tip.
I've
the
just
cheeks
never
are
seen
out.
such a noticeable tracheal shave. I don't think I've ever noticed one like that before.
Thank you. And we got that flat. And we hit the scar really high under your chin so you can't see it.
I'm so impressed.
Okay, good.
Oh my gosh.
That's crazy.
Peter, get a side profile picture.
So what do we do now? So we're gonna, Ina is gonna give you a special facial brow to wear.
Okay.
And the key thing we gotta make sure is it doesn't put pressure low, the band goes on top. Okay, because there's a plate here, okay?
Yes.
Now, because your cast popped off, your nose is at risk of moving.
Okay.
We have to be careful, okay? So gentle activity,
Okay.
nothing strenuous until I see you next week and we'll take the tape off of the internal splints. You still have internal splints supporting your nose, so we'll keep that going.
Okay.
Now, the swelling is the most in the cheeks, the eyes, and the chin. So this will all come in as you heal.
Okay.
But everything looks super, okay?
Awesome. Thank you.
I know when we talked, the areas that bothered you, that stood out to you the most were the chin, the jaw, and the nose.
Yep.
And I focused on all of that plus everything else that we did, okay? So now, it's always tough to see yourself sometimes. I know you're excited now, but when you go home, it's difficult sometimes. And we're here for you. You have my cell phone. You can call me night or weekend anytime.
Okay.
During office hours, I'm in surgery often. Just call the office.
Okay.
But this road is not easy. But it's one that we're on together, and I'm going to help you.
Thank you.
Okay?
Thank you.
All right. Thank you.
Thank you so much.
Of course, of course.